We hope everyone is having a fantastic Wednesday in spite of all the rain and water. We hope you've all been able to float to your practices to be able to see patients. Today we're going to deal with workers' compensation and a patient's choice of provider within work comp. And so really when we start to talk about a patient's choice, there's two realms that we have to live in with work comp. The first is where an employer has established a preferred provider program, or a PPP, and the other is where they do not. Now, the vast majority of the employers in a state do not have a preferred provider program in place for workers' compensation. So most of the cases we're going to deal with are just standard work comp. In those cases, a patient has two choices of provider and then all of their referrals. And so the referrals and the referrals of the referrals do not count as a separate patient choice, just the initial patient choice. Now, also in those two providers, when the patient makes the choice, it does not include any kind of emergency care that the patient would have received or any non-emergency care that they would have obtained prior to notification of the employer that it was a work comp injury. Now, you do want to make sure that your patients are notifying very quickly their employer in regards to their injury, because there is a time limit on that. Now, when we get back over into the preferred provider program area, that PPP area, there are about 25 total of these programs in Illinois that have been registered with the state, and not a ton of our employers are really utilizing them at this stage. But if they do utilize them, one, they have to notify the patient that they have a PPP in place, and in that case, then it's the patient's responsibility to make sure that you know that employer has a PPP, and then it's their responsibility to choose the appropriate provider in that case. And so they have to choose someone within that PPP. Now, they would be able to choose as many as two providers within the preferred provider program if that is established. However, the patients are also able to opt out of the PPP at any time in writing to their employer. And at that stage, then, they would still kind of obtain two choices, but the way it would work is their first choice is tied up in the PPP. So they would still have to, by opting out of the PPP, that is kind of their first choice. And then their second choice would be a provider outside of the PPP. So in that particular case, once they've opted out, then really it gets them down to one choice of provider and any referrals that come thereafter. So really in the two worlds, non-PPP world, the non-preferred provider program world, then at that stage the patients have choices of two physicians. If they haven't opted out, then they have a choice of two physicians within the preferred provider program. And lastly, then if they have opted out of the PPP with their employer, then they would get really just a choice of one provider at that case. So hopefully this information helps you out in your practice, and we'll catch you next week. Thank you.